Arthritis can lead to not only physical pain for a person when it involves a joint, but there are also deformities that can develop as the result of arthritis. If you are experiencing pain, if you have one of these deformities that we'll discuss, those are signs that it might be of benefit for you to go and be evaluated by an orthopedic surgeon. The hip is a ball and socket joint, and there are certain diseases which can cause people to develop wear and tear of the cartilage on the surface of that ball and socket joint. Diseases such as osteoarthritis, avascular necrosis, those type of things can lead people to develop bone-on-bone contact in that ball and socket joint. This is a very painful condition. This can lead people to have difficulty with normal day-to-day activities such as walking distances, tying their shoes, getting in and out of a low car. It can even cause people to have difficulty sleeping at night because pain will awaken them. When we are treating arthritis of the hip, commonly we will discuss the option of a total hip replacement surgery. In a total hip replacement, what is being replaced is both the ball and the socket of the hip joint. This is an example of a hip socket, and this is an example of the metal shell that we would use in order to replace the worn out socket in the ball and socket joint of the hip. Here is an example of the implant where I have replaced not only the socket here, but the ball as well. And the particular implants that we have available to show you here today involve a metal socket, a plastic liner inside the socket, a metal stem that goes inside the femur bone, and in this case, a ceramic ball that goes on the end of the stem of the femur. This ball goes into the plastic socket and becomes the new ball and socket joint of the hip. And it eliminates that bone-on-bone contact and is significantly helpful in relieving pain for people who have advanced arthritis of the hip. Really, when we are discussing the cons of surgery, the main issues are the potential risks of surgery. Things like infection, bleeding, nerve injury, blood clots, complications with anesthesia. Before the surgery, we will have a patient work with their doctor to make sure they are as healthy as possible before an operation. That helps us to really limit those risks as much as possible. The pros of doing a hip replacement or a knee replacement surgery are that by eliminating the bone-on-bone contact, by eliminating that arthritis pain for people, it can restore a healthy and active lifestyle. It can allow people to get back to a very much more significantly pleasant quality of life.